Welcome to the Healthy Perspective Podcast with your host, chiropractor, entrepreneur, mentor, and author, Dr. Chris Bowman. He'll break down and extract the secret sauce behind his own success and the success of some of the top leaders in every category and from around the world. Get ready for your weekly mental adjustment because shift is going to happen.
Hello, everyone. Thank you for joining us on another episode of the Healthy Perspective Podcast. Today we have Dr. Benham. He is the founder of Dermatology and Hair Restoration down here in Southern California near me. I'm so stoked to be able to talk with Dr. Ben, even though we're in completely different fields. I work with the spine, the inside of the body, and he works with the skin, the outside of the body. We're having a chat a little bit before, and ultimately it's about helping people live better lives. Whether I do that through pain and he does that through, I'm sure there's some pain with skin and, but looking at cancers, looking at scars, looking at self-confidence, looking at answering questions about how people can take better care of the skin instead of just maybe putting chemicals and things like that. There's a lot of things that we have in common. And so I'm so excited to bring this different perspective on health with Dr. Ben. Thank you so much for joining us.
Hi, thank you so much for having me.
Awesome. Well, did you always want to be a doctor, or how did you kind of get into the field that you're in now?
That's a really good question. So actually, I didn't always want to be a doctor. Back in college at UCLA, actually, I wanted to be a computer engineer, actually, believe it or not. And I self-taught myself how to code websites, HTML.
Wow.
This is back in 1996.
Wow.
But it really wasn't my calling. I ended up becoming a microbiology major and ended up going to med school. And actually, initially, I was looking at cardiology. But believe it or not, the skin is something that's really attractive. There's so much you could do about it. And there's so many ways they could really help people just from like skin cancer point of view or just, patients with rashes. I was always the one who always had eczema. I had a specific type of like autoimmune hair loss issue. I had really bad acne and I went on Accutane. So I had a lot of skin issues all my life. So I kind of felt that dermatology was really my calling, when I went to med school.
That's amazing. And you went to UCLA. Did you grow up out here in Southern California? Or?
Yeah, I grew up in Westwood. Pretty much, I've been in LA ever since 1987.
Wow.
I went to UCLA undergrad, ended up at UC Irvine for med school and residency, and I moved back up to LA, after I was done. So I've been a local Southern California kid all my life, pretty much.
I love that. I'm sure the beach is participating in your healthy regimen of skincare and health and whatnot too.
Yes, absolutely. Yes. Yes, for sure. It's Southern California. I almost ended up at UCSD San Diego, but I realized if I go there for med school, I will always be surfing. So I went to Irvine instead. Great call. I tell you, great call.
Right. A little bit of self-discipline there. I love it. Awesome. Well, we're having a bit of a discussion before we started recording just about this profession being much more than just vain people spending money that most people don't have to look the way nobody can really look naturally. I think that's maybe a perception that some people get when they think of a skin treatment or a hair treatment or something like that. We kind of took the spin of the work that you're doing is truly helping people not just look better. Obviously, they'll look better with those sort of things, depending on your point of view. But there might be a scar that reminds somebody of a certain event in history that if you can make that go away or look less, might actually bring some emotional healing. Why don't you talk about that just a little bit, about the work that you're able to do with people and how it's boosting self-confidence and maybe what the result of having better self-confidence have done for people?
Yeah, thanks so much for that introduction. So, see, I agree with you. One of the good things about dermatology is that there's so many different things you could do. You could do purely cosmetics. You could focus on just skin cancer, which is great. Like yesterday, I was in clinic and we did skin cancer surgery. We did 4 surgeries, just removing skin cancer, which is really helpful, and beneficial for patients, and they're really appreciative. And, and also another thing is that someone like in between the cosmetic and medical, like scars. So one of the things that I focus on is acne scars in my clinic, but also I'm in practice with my twin brother who does only hair transplants.
Oh, wow.
And it's very interesting that you brought up the scar, because he also does a lot of scar revision. So I'm going to tell you a story about something that I've done with scars and something that Dr. Sean has done with scars. So one of the stories that comes to mind is years ago we were doing a hair transplant procedure on this young gentleman who had a really bad scar on his scalp. So we're doing a scar revision on the scar on the scalp. The way he got the scar was that he had gotten into a car accident, unfortunately, when he was younger, where sadly one of his siblings ended up passing away in the car
Oh
accident.
no.
So the scar always reminded him of like the negligence and the car accident and like missing his sibling. So what we did was that we ended up going in there, doing a scar revision, removing the scar from his scalp, then removing some hairs from his back, and basically kind of doing like a mini hair transplant to cover the rest of the scar. And for him, that was not just a physical scar; it was a true emotional scar, and kind of getting past that, was truly traumatic for him. I mean, when we saw him back in clinic, he literally cried for a long time because
Mm.
he didn't have that constant day-to-day reminder of that episode that happened basically when he was younger. So, that's one scenario. Another scenario that happens, honestly, on a more regular basis is that I do a lot of acne scars, and a lot of acne scars. I mean, unfortunately, generally acne scars are really not that bad, but there's some cases where it could be really bad, and
Mhm.
when it's really bad, unfortunately, patients go through this like years of like kind of traumatic events. And for that, what I mean is like in this particular case, I mean, this patient specifically told me that like every time when people would talk to him, they would not look at him, but they would look at these deep indents on his cheeks. He's a gentleman in his like early 50s. And unfortunately, he said like every time we would go out on dates, like he just felt embarrassed, ashamed, and really not at the same level as the person that he was going out with. And he always felt that he was being judged, you know. He would tell me, if you were to walk on the street and it was dark, people will kind of go away on the other side just because, he felt that people thought that he was a little bit like scary looking,
Wow.
and he's actually does a lot of acting for some of the local studios, like not main roles, but kind of like on the background. And he was saying that prior to the acne scar removal, he would rarely get any roles, even as a secondary actor, just be in the background. After we did like a major procedure on him, he said he went back to the studios and he felt that the way he was treated was completely 180% different. He wasn't judged, people were more welcoming, people actually looked at them in the eye and spoke with them. And for him, being living with this for like literally 50 years and having this type of response from people, and actually he actually had a role on an HBO film, a HBO episode. It was really life changing. So it's
Mm.
something very simple as kind of getting in there and doing a subcision or trying to fill in some acne scars that really changes people's lives because it changes other people's perspectives of them,
Right.
and that's really the most important thing.
And that's it's really interesting, kind of what I said in the beginning is the I don't know, the first thought I'm sure that comes to a lot of people's mind, maybe not in California because it's kind of a normal thing for us, but maybe somewhere else where it's like, oh, all you do is scar removal or skin treatment or those sort of things that like you're just making those actors look ways that people can't look themselves. Well, if we didn't expect those things of people, like if that person was treated normal with his scars,
Right.
we wouldn't even need to think about filling them in. But because society puts pressure on you to look a certain way, I mean, that it's kind of like a self-propelling, like, so it's not just the people that are to blame for vain interest. It's that honestly, a movie with somebody like that might not sell as well as a movie with somebody that looks better. You know what I mean? So really, we got to look in the mirror at what we expect of people. Not that it's a bad thing getting a scar revision or, those sort of things, but that's really a heart check for us, thinking, man, would I want to see a movie where the hero looks like a traditional villain, or, like something like that. And I think that's a really helpful thing for us to realize, where, that the depths that somebody has to go to feel accepted and normal is kind of crazy, especially in Hollywood.
Yes, and also especially today, I think like, see, when I grew up and I had a lot of acne on my face, and you know what? No one cared, because you know what? There was no Facebook, no Instagram. I mean, how many times did you take a photo of yourself in the 1990s?
Right.
Honestly, I don't have photo. Like, yeah, I have maybe 2 photos from like
Right.
high school,
Right.
Whereas every day now, kids in high school take 10 photos a day
Right.
and on Instagram and Facebook. So, it's just, we live in a much more social world, much more public world.
Yeah.
And look, if you look at the movies from 60s and 70s, there was that one great actress that looked amazing, and everybody else kind of, had
Look
pitted
normal.
acne scars all over the face, and no one really, and that was expected, no, that was normal.
That's
But
true.
right now, it's not normal. So unfortunately, the society as a whole basically has changed.
Yeah.
And that's why it's harder for everyone else in general. Look, I mean, a lot of stuff I do in my office, like, so we do like, like a lot of skin cancer stuff, skin checks. We do like a lot of acne scars, but we also do a lot of hair. And again, all ties in with the fact that people are just taking more photos of themselves. They're on social Instagram every day, and hair is important. I mean, it is,
Right.
and
Right.
people judge you. Unfortunately, that's the truth,
Right. Right. So when people come to you, obviously things have been going on for a long time. Their hair is almost out, their acne is really bad, their eczema is really bad, their skin cancer is to the point where, you can see it and need to remove it. I would assume that if you had the opportunity to chat with everyone about preventing those things from happening, what would be maybe some of your top tips for acne, because obviously they're different for everybody, maybe for acne, for hair loss? What are some of the things that you're finding where if you could talk to somebody when they're little, like, hey, you're going to see me in 20 years unless you...
Yeah, a great answer. Let's talk. Yeah, great question. Let's talk about some of this stuff. So acne. So I truly believe, I mean, unfortunately, like a lot of people that have acne scar is because they did not treat it early on. I mean, sometimes people break out in a month or two with extreme acne, and that you can't prevent.
Sure.
But a lot of time, the problem with acne is that it goes on for like a long time, and it's that inflammation on the skin that basically breaks down the collagen and causes those depression. So the key is see a dermatologist early, and try multiple different regimens. Another problem is that a lot of people are afraid of taking oral antibiotics or even gone Accutane. I'm not saying Accutane is for everyone, but if someone's really severe, I rather put on Accutane, because if they end up with those acne scars, they're going to have a lot more depression, a lot more anxiety, and a lot more social stigma if they don't treat it. So the consequence of having the acne scars is worse than taking antibiotic for 6 months. So early treatment and early prevention is always the key, and sometimes you have to be aggressive. Number two, for skin cancer, I mean, unfortunately, I have to say that there's a huge difference between males and females. Females are very much on top of it. They see something, they come in right away. Guys, sadly, they just let it be there. I had a patient who had a huge skin cancer in front of his eyes and was there for 10 years. I'm like, I don't understand. How come we didn't come in earlier? He's like, well, the first 5 years, I tried to see if it's going to go away or not. I'm like, okay, what happened to the second 5 years? I was just too busy. It was already big anyways. I just didn't want to come in. But that's like a typical answer that a guy gives,
Right.
So, but majority of time it's not going to be fatal, but unfortunately, sometimes it is fatal. I mean, if you have like a melanoma, so I had another patient, very busy gentleman, investment banking, bleeding mole on the back. And he's like, Doc, I was very busy and then come in. Well, a bleeding mole is not a good idea. I mean, unfortunately, it was an invasive melanoma. Luckily, it still wasn't that deep. We were able to basically get it out on time, and he survived. But it's a lot more headache. You have to see a lot of doctors, PET scan, CAT scan, surgeries. So early prevention is the key, and honestly, sunscreen, staying out of the sun, those are all really the key. And then for hair loss, look, a lot of people are genetically predisposed to hair loss. Stress is one of the major triggers of hair loss. Remember, I didn't say the cause. as a trigger, which means you're genetically predisposed, you go through a stressful event, it triggers, it accelerates, it makes the hair loss go faster. So the key with hair loss is number one, what you eat is basically it's very important for hair loss, you know. So taking your vitamin D, taking your iron if you're female, taking a multivitamin, not eating processed foods, you know, staying away from all those muscle shakes that basically are used for muscle building. Those are really bad. Staying away from creatine, staying away from soy milk. Those all increase your testosterone level in your body. So those are bad. Another thing is, you know, kind of, again, early, you know, the sooner you start basically prevention with the hair loss, the better it is. So, you know, if you think you're really losing your hair, seeing a specialist where you could go on oral Propecia. Now there's topical Propecia, that the topical medications basically um that also help with your hair, so you don't have to ingest something orally, which has lower risk of side effect. I mean, we founded this company called Happy Head that, you know, is a prescription grade topical medication. So it's easier for patients because they don't have to take it. It's just topical. It has low risk of like side effects in general, and it really works. So, you know, that's, you know, one way they could do it. So the key is, you know, the earlier you do it, basically the better it is. And then sometimes, look, you can't avoid it. I mean, unfortunately, I had a very young female that came to my office about a few months ago, and unfortunately she had gotten pregnant accidentally and ended up with aborting, unfortunately. And you know, it was very traumatic for her because she comes from like a family where, you know, these things are not talked about, and she had to hide a lot of stuff from her parents, you know, which added more stress, and she ended up in a situation where she lost 60-70% of her hair just from all that stress.
Wow.
So that is something, you know, unfortunately it happens, you know, sometimes unavoidable. But you know, the doctors that could help. You know, I had
Right.
another patient from San Diego who ended up with COVID and ended up losing 80% of her hair. You know, she's like a 22-year-old girl. That's
Wow.
very trust me, that's a lot more traumatic for her than the COVID itself. You
Right.
know, so and I mean, she literally drove to my office crying. You
Oh,
know, again, those things will really impact them socially. You know, like from boyfriend issues, school, work. You know, so
right.
again, you know, a lot of times, you know, doing things early, you know, prevention is the key, or kind of, you know, stepping in at an earlier stage. That's really the most important thing, because if you're going through that shedding phase, it's easier to get you started on certain procedures and medications to slow down that shedding,
Right.
as opposed to wait for all that shedding to happen and then let's talk about regrowth.
Right. Right. Yeah. Makes sense. I mean, it's like somebody comes to see me with a
Right.
arthritic spine that has no disc. And it's like, well, I mean, there's not a lot to do at this point. Like, you know, it's pain management. We with this, it's got to take a lot to, you know, to go back to the way it used to. Not that it's impossible, but you're talking about stem cells and ozone and all these decompression therapies, and, you know, versus coming in earlier, right after a car accident, or, you know, when your body's feeling good, to prevent things from getting bad. It's much easier to take care of it at that point than, you know, when it becomes a problem. And I think a lot of people have problems thinking ahead. You know, a part of what I just released a book, is it 2 weeks ago now? Yeah, geez, on the 16th, called Perspective: Rewire Your Brain for Success and Abundance. And I talk about, in the beginning, a lot of times people's stress overwhelm their ability to cast vision.
Yes.
You know, so you're talking about, like, this is skin cancer. This could have a major life effect, but they're so focused on what's happening right now that they're
Yeah.
not able to project into the future, you know, what's going on. And so I think that's the key for prevention, where it's like, not just, you know, I'm going to treat this when it affects my life so badly that I can't go on anymore, you know, but staying ahead of the game to make sure that it never gets that way.
Right. You're correct. You're absolutely correct. Do you guys do a lot of stem cell these days for spine and arthritis and
A
everything?
lot of chiropractors do. I haven't chosen to get into it. I don't see that sort of population too often. I'm a diplomat in chiropractic pediatrics. So I see a lot of kids with autism, ADHD, a lot of young babies, pregnant moms.
Nice.
Those are the kind of the population that I see a lot. I'm not really in the Medicare, or, you know, like that type of age where stuff typically is pretty degenerated. But I do know a few people in my area that do that, and have seen some pretty successful procedures. So cool. Well, if people are looking for to get a treatment from you or to learn more about you, where can they visit?
Yeah, so my office is near Santa Monica. We're on the west side. So it's called Dermatology and Hair Restoration. And yeah, you can always come up, if you're in California. I have a lot of patients that usually fly in or usually basically just drive up, and we're more than happy to treat you.
Awesome. Well, thank you so much for joining me. I appreciate it. I'm excited for people to listen to this because I think it's going to give people hope, that I don't have to live like this forever. There's something that I can do. So thank you so much for jumping on.
Well, thank you so much for having me.
Thank you for listening to the Healthy Perspective Podcast. To connect with Dr. Bowman, follow him on Instagram @Dr. Chris Bowman. Until next time, make shift happen.